Adaram, they say, whenever I leave the house, and on whatever thing my eyes fall on,
وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما
Allah Ta'ala says, Wallahu yuhibbu as-sabirin. Allah Ta'ala is lief with Adikina.
School governing body of South Coast Madrasa.
وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه وسلموا تسليما حتى تنالوا.
Thank you all for joining us today. Thank you, Your Excellency, for joining us as well. It's a real pleasure to host you on this beautiful morning here. Ladies and gentlemen, my name is Owen Ryan. I'm the Executive Director of the International AIDS Society. We are one of the co-conveners of the International AIDS Conference, which in 2016 is returning home to Durban. We are really excited to be with you this morning to talk through our program. I have a distinguished panel of guests who I will not steal their thunder from all their remarks. But I did want to take just one moment and talk a bit about those who have made it possible for us to be here today. On this occasion, we have brought together officially the Private Sector Reference Group. This is the first time ever that we're doing this for an international AIDS conference. This group is charged with harnessing the authority and the power and the expertise of the private sector and helping bring it to the International AIDS Conference preparations. South Africa is unique in the world for having an unparalleled private response to the HIV epidemic, and this group has been charged with bringing that to our agenda. Ladies and gentlemen, our first speaker today is Professor Chris Beyer. Chris is Professor of Epidemiology, International Health, and Health Behavior and Society at the Johns Hopkins Bloomberg School of Public Health in Baltimore in the United States. He is the current President of the International AIDS Society and the International Chair of AIDS 2016. Thanks, Chris.
Okay. So I thought I would put forward for you some ideas about what we've been thinking about AIDS 2016, the meaning of the conference, what it will be like coming back here after so long, and also how AIDS 2016 may act to galvanize the African and indeed the global HIV response over the next 2 years. We really need to do this for two reasons. One is to address the treatment and prevention gaps that we still know are so important in the AIDS response, and also because we want to be better positioned after AIDS 2016 as a community and as a movement to implement some of the amazing new science that is coming our way. It's perhaps inevitable that much of the global conversation and the media conversation around AIDS 2016 is going to look back to the last International AIDS Conference held in Africa, and that was the landmark Durban Conference of 2000. It will be 16 years since the conference has been in Africa, and in 2000, many of you will recall that we had antiviral therapy, but it was available only to those living in the global north. How far have we come since then? South Africa now has more people on antiviral therapy than any other nation, and this great country is in many respects a microcosm of the global epidemic. Extraordinary progress has been made in rolling out antiviral therapy, in prevention and treatment and care, yet there are continuing gaps and challenges, and certainly the gaps around key affected populations, the ongoing stigma and discrimination, and the particular challenges that we see with adolescents, young girls, and young women who really face unrelenting rates of HIV infection in this country. So there are many, many reasons for hope, but there are many challenges ahead, and both the hope and the challenges are what we're going to highlight in so many fora at AIDS 2016. Let me highlight one additional challenge that all of us concerned about HIV and about human rights in Africa are very well aware of, and that is the recent wave of policies and laws aimed at increasing repression and discrimination against some marginalized groups. Witness the anti-homosexuality laws that have been introduced in a number of countries on the continent but also elsewhere over the past 2 years. We know from 3 decades of work that marginalization only drives HIV epidemics underground and only serves to increase and aid and abet the social risks and harms of HIV. Nevertheless, we see these laws and policies. And it's again a reason why South Africa has such a critical role to play, because of course your constitution, your new constitution, a magnificent document that our distinguished guest played such an important role in helping to create, is the first on the African continent that recognizes full citizenship and human rights for lesbian, gay, bisexual, and transgender communities. And that really is an extraordinary strength. We believe that if we want AIDS 2016 to make a difference, we need to work together as a community. We need to bring together an array of stakeholders in a real multi-sectorial response. That includes providers and researchers, decision makers and community leaders, people living with HIV, and of course, business leaders. And in much the same way that the scientists here have so much to offer the global response, so too does the business sector, the private sector. The South African private sector has been leading in HIV for a number of years, and often on under the leadership of my esteemed colleague Brian Brink, who's with us on the panel this morning. The private sector here has taken leading roles in things like HIV testing and counseling, in providing treatment for employees, their families, and communities, but also in really engaging and supporting the scientific and public health efforts that have been underway in this country. It's a model that we believe other countries could learn from, and it's why the International AIDS Society is so keen to promote today's initiative. This is really a first for the international AIDS conferences to have this kind of private sector engagement so early on, and we really hope that this is going to be a model for going forward for the future. So it's my hope that today's launch of the private sector reference group really marks a turning point, and that all future conferences will embrace this concept post-Durban, and that will hopefully be one of the many legacies of Durban 2016. Thank you so much.
Thank you, Chris. I'd like to welcome next our co-chair for AIDS 2016, Dr. Olive Shisana. Dr. Shisana is CEO of the Health Sciences Research Council, and she, as I said, is a co-chair for our conference. Welcome, Olive.
First of all, let me welcome Your Excellency, the Deputy President. It's really an honor for us to have you here, and ladies and gentlemen, and the media and everyone else. I'm very much delighted to be here today with the Deputy President, with a scientist, and a business person to come and promote the role of private sector in the South African and global AIDS response. We've really come a long way. You'll all agree. It's been a long way for those of you who know the challenges that this country has been facing with regard to the relationship between the private and the public sector. So we're very happy that today we're here and we're able to stand together and say to the world, we are on our way to host the 2016 Global AIDS Conference in South Africa. I'm very much thankful to the South African government for its leadership and financial contribution to the AIDS 2016. And I'm particularly grateful to the Deputy President for personally invigorating the South Africa's multi-sectoral response, which I believe if we don't do that, we will not be able to sustain the progress that we're making, especially in terms of social and behavioral contribution to preventing HIV. I'm also encouraged by the approach that the South African National AIDS Council has been taking in terms of relying on scientific evidence in order to come up with intervention. The use of scientists to frame South Africa's response, I believe, will go a long way to helping the country to strategically use the resources that we have in order to reduce new infections as well as to reduce mortality due to AIDS. I'm very happy that for the first time, the private sector is not only a financial contributor to the conference, but is also involved in shaping the program by bringing together the information that they have so that they can share it with the world to see what it is that they've been doing. And I think that they've been in the forefront of actually providing treatment, reducing stigma, and also ensuring that the workplace programs that prevent discrimination at the workplace setting, it's been a great thing that they've been doing, but not many people have been aware of what it is that they are doing. This offers them an opportunity to be able to share with the world exactly what it is that they are doing. And I also support the initiative of the International AIDS Society and concur with my colleague, Chris, that there are many lessons from the private sector which can be replicated elsewhere. So it's not just only sharing, but it's also the question of, can this experience be replicated elsewhere? And of course, with Brian Brink now being, where is he? He's over there. Brian Brink now being appointed as a private sector reference group chairperson, we're hopeful that we're going to be able to achieve the goals that we've set up for this particular sector. In a nutshell, Sub-Saharan Africa, despite all the impressive gains that I've indicated above, still shoulders a vastly disproportionate burden of the epidemic with high prevalence and mortality. That's some 12 million people on the continent, that is a third of the global number of people living with HIV, are still unable to access antiretroviral therapy. It's at the same time an extraordinary impediment to further reducing mortality in the continent. We welcome South Africa's expansion to access to an additional 2 million people on ARV by increasing eligibility to treatment for HIV-positive people with CD4 count of 500 from January next year. So, Chris, the 4 million that you are looking for in the world, 2 million are going to come from South Africa under the program. Under the program that is actually headed by the Deputy President here, Sanak. That is what the 2016 agenda is going to be about, and I'd like to thank you so much for giving us the opportunity to share with you, and hope you're going to walk with us until we get to Durban in 2016. Thank you.
صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه.
And so next up we have Dr. Brian Brink. Not only is he the chair of the Private Sector Reference Group, as you've heard, he is also the Chief Medical Officer of Anglo American. Dr. Brink.
Thank you very much. Deputy President, ladies and gentlemen, good morning. We in the private sector know that in order for our businesses to succeed and to be sustainable, we must ensure the health of our workforce, the health of the communities within which we operate, our customers, and our supply chains. We also know that HIV infection has its greatest impact on people of working age. So we have learned that the private sector cannot just sit idly by and wait for government and civil society to respond to HIV and AIDS. The private sector must be a significant contributor and, more importantly, a trusted partner to both governments and civil society in the HIV response. We've made enormous progress since 2000, and we can look back with a great deal of satisfaction on what has been achieved by the private sector, especially in Southern Africa. However, there's still a lot more to do. We cannot be complacent. We have to sustain this response to HIV and deal with the emerging challenges, particularly ensuring access to quality treatment for all, leaving no one behind, and also improving our prevention efforts. We simply have to stop the new HIV infections. We have to get that number to 0. And we also have to make sure that nobody gets sick or dies from HIV. We can do those things. And as private sector, we want to be there leading this challenge along with all the others. We know that in order to succeed, we have to strengthen health systems. That's the only way we will ensure the sustainability of the response. There's a lot that the private sector can do to help strengthen the health system. There are so many aspects, if I think just of the procurement and supply chain, if I think around financial management, information systems. There are so many things that we do every day in business that can help in the response to HIV. We want to share those skills with the broader community and make sure that we get a better response, not only in Southern Africa, but worldwide. So we look forward to the private sector being a much stronger participant in the AIDS 2016 conference than has ever been done before. The private sector reference group has already started working on making a real difference. The 4 companies that you see here today, Chevron, Discovery Health, SAP, and Anglo American, have each been leaders in making financial contributions towards this conference. I hope that the private sector will match the South African government in the financial contribution that is made to this conference, and that is certainly our target, which we hope to achieve by 2016. So there are many other companies that will join us. And each of these companies that is here today have huge spheres of influence in business. And we will be asking them to use that influence to bring many other companies together into responding to this challenge. Our first meeting of the Private Sector Reference Group, the first formal meeting, will be held within the next month and is going to be hosted by SAP. I thank you for doing that. And we will move around all our other private sector partners to make sure that everybody is involved. And this will be an international business effort. But I particularly want to say that South African business is going to be in the lead in showing worldwide business how we can best respond and be a good partner. Thank you.
Thank you, Brian. I'm privileged now to introduce our final speaker, His Excellency, the Deputy President of South Africa, Mr. Cyril Ramaphosa.
Thank you, Chairperson. It's a real joy and pleasure to welcome Professor Chris Beyer, who is the President of the International AIDS Society and also the International Chair of 2016 Conference on AIDS. Dr. Olive Shisana, the CEO of the Human Sciences Research Council, and also the local chair of AIDS 2016, and Dr. Brian Brink, who is the chair of the entity that's mobilizing the private sector to be a well-moneyed and effective partner to this conference. So it's a real joy to have all of you here. For South Africa, it's going to be a real honor to host the 21st International AIDS Conference in Durban in 2016. This will not be the first time that we are doing this. It will be the second time. We last hosted this conference in the year 2000 in Durban. The return of this conference to Durban is highly significant for a number of reasons. But one of those is that our provincial government is already getting geared up to host this conference, and they're already setting up structures to properly prepare for this conference. And we have no doubt whatsoever that it will be as successful as other conferences that have been held both in Durban and also the recent one in Melbourne. The 2000 conference was pivotal in focusing the world's attention on the impact of HIV, particularly in sub-Saharan Africa, and fundamentally changing the course of the epidemic on the continent. It is worth recalling what former President Nelson Mandela said at that conference. When he closed the conference, he said, "Let us not equivocate. A tragedy of unprecedented proportions is unfolding in Africa. AIDS today in Africa is claiming more lives than the sum total of all wars, families and famines and floods, and the ravages of such deadly diseases as malaria. It is devastating families and communities, overwhelming and depleting healthcare services, and robbing schools of both learners and teachers. A decade and a half later, thanks in large measure to the deliberations at that conference and the unparalleled response of the global health community, we have made much progress in tackling the epidemic in Africa, as well as across the world. But although we can claim many achievements, we cannot yet claim success. Several countries on the continent have implemented massive treatment and prevention programs that have had a marked impact on HIV incidence, life expectancy, and maternal and infant mortality. South Africa, with the highest number of people living with HIV in the world, has rolled out the world's largest treatment program with well over 2 million people initiated on antiretrovirals. Though we have made progress in many areas, we are still concerned about the stubbornly high numbers of new infections, the challenges we face in ensuring that those who are on treatment are supported to continue taking their medication, and that stigma continues to undermine the impact of our programs. As we prepare for AIDS 2016, we will intensify our efforts to address all these challenges. We are determined that by the time we meet again in Durban, we will be able to report much more significant progress on all these fronts. If we are to achieve the objectives articulated at AIDS 2014 in Melbourne, Australia, earlier this year, we need to ensure that the response to AIDS remains prominent in the post-2015 Sustainable Development Framework. We need to ensure that the international community continues to affirm the inextricable link between development and health. In our quest for social justice and equity, we need to ensure that the development community, the G8, and other global health platforms continue the focus on ensuring what we call universal coverage. There is a need for a sustained collaboration between various sectors of society. We need to strengthen the social compacts that have been developed over the course of many years. In this context, I wish to commend the South African private sector for the initiative they have taken to combat the epidemic. I also wish to commend all our partners in SANEC for the contribution they continue to make, both individually and collectively. Through collaboration and coordination, through learning from each other, through engaging with each other, we will enhance our ability to bring the epidemic to an end. I thank you.
صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما 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 صلوا عليه